presents Tell Us Your Business, where you're invited on the air to tell us what makes your business stand out in the community. It's important we hear from you to tell us all we need to know about what you do best. Tell Us Your Business uses the latest radio and television production systems, and all shows can be seen on amp2.tv. If you have a question for our guest, call 888-565-1470. Now, let's get ready as our guest hits the airwaves and informs us about what we need to know on Tell Us Your Business.
Good evening. This is Ivy with Tell Us Your Biz. I am so honored to have with us this evening Dr. Rafael Sierra. He is with the Sierra Robotic Hair Institute, and I am so excited to interview him tonight because hair loss can be such a debilitating thing for men, for women, anybody that's going through something like that. And it's very, very important to have a doctor to be able to rectify that and to do it in such a way that is very, very professional and well done, and that is no other than the Rafael Sierra in front of me. So I would love to talk with him tonight, and I'm excited to do so. How are you this evening, Dr. Rafael? Are you doing well?
Hi, Evie. I'm doing very well. Thank you for having me.
Fantastic.
I'm happy to be here.
Wonderful. Can you give me a little bit of your background and how you started? I know I've heard that you were also a doctor of oncology, you were a doctor of general surgery and did surgery in both. Tell me a little bit about your background.
Yes, so I'm originally from Mexico. I went to medical school in Mexico City, came to the United States, did some research initially when I came here, did about 2 years of research that included some robotic surgery, then did my specialty at Tulane University. And after I graduated, I started practicing as a general and oncology surgeon, focusing in robotic surgery for the last 10 years plus.
Okay, so you have a lot of experience in many different types of surgeries. That's quite important. Now, you have a hair restoration institute that's about to open in about 2 months, I believe. Is that true?
That's true. We're about to open at probably the end of April. I'm very excited. We have a state-of-the-art facility. We're finishing up all the details, so we're trying to make this a place where people can come in, feel comfortable, that they can express any kind of concerns, and we can help them feel better in many ways.
So I have known both a male and a female in my life up until now who hair loss became a debilitating factor for them emotionally. It wasn't just physically, but it was emotional, and it seemed to be psychological how it affected them. So I was so sad for them, and I didn't know what they should do at the time. I didn't know somebody like yourself that I could say, hey, I'm recommending this person, you should go there. It is so vital to have someone like yourself that can actually have these state-of-the-art, advanced surgeries where you can really change people's lives. Do you work on both men and women? If so, tell me about that.
Yes, we definitely do. And one of the things that I think is important to mention is that hair loss is a process that takes years. So our goal is to have patients to come and we'll customize their treatment. And if we think that they can be treated initially with a non-surgical approach, there's medications, there's certain there are laser treatments, there are things that can be done to slow down or prevent more hair loss. And if at some point we think that it's necessary to perform a transplant, then we do that. But yes, and like you said, it's something that affects both men and women, and it's very, it might seem sometimes a little superfluous or superficial that somebody gets very worried about the hair loss, but in reality, there is many studies that have shown a direct relationship between hair loss and decrease in self-esteem, sometimes even with will affect in job or relationships.
Of course, in fact, I have heard that some men or some women, they don't want to date if they're single. They want to stay home more. They don't go to the gym. And I also was doing some research before I was about to interview this evening, and I read that a person's sexual life can actually be affected if their self-esteem is low. So do you find that some of your patients, their sex life is lacking because their hair loss is depleted and they come to you for this type of procedure and they actually have a better sex life because of it?
Yeah, and again, there's some studies that have shown that there is a direct correlation between hair loss and erectile dysfunction, mostly because of issues with self-confidence and those things reflect on that aspect of people's lives. And once we are able to replace that hair that has been falling, then yes, they do mention that one aspect of their life that improved is their sex life.
Well, that's quite important because our self-esteem is really where it begins and ends. So if we can feel good, I know that when I put on lipstick every day, I feel better than when I
Right.
don't have it on as a woman, or when I curl my hair or I have a full head of hair. Of course, it boosts my confidence. So if I needed something like this, I mean, it would be imperative that I seek it out and seek it with the best person possible. Now, you mentioned that you do non-surgical and surgical options. I remember back in the 80s, I think when this all began with the hair transplants or the hair plugs, it was not nearly as advanced. Can you tell me how has it advanced, the last 20 plus years, and what you're doing differently today with your newest technologies?
Yes, definitely has changed, just like a lot of things in medicine, but in specific for hair transplant, like you mentioned, in the early 80s, there was hair plugs. Then for many, many years, the kind of the standard of care was to perform what we call the strip, where we remove a part of the scalp in the back of the hair, of the head, and from there we would obtain all the hair follicles and then transplant those hair follicles to the area that we're trying to replenish. The problem with that process, which is very good, I mean, it has very good results, is that people will have a scar in the back of the head, and that's going to be visible unless they wear a certain length of hair. More recently, there is a technique that is called FUT, which is one hair follicle at a time. And what we do is remove one hair follicle at a time from the back of the hair, and then transplant it to the front. The advantage is that the patients don't have any scars, and they can wear the hair any way they want. There is no, obviously there's less chances of wound problems and infections and things like that. So that was the technique that initially was done manually. So you can imagine we're talking about 2,000 hair follicles, 3,000. So it was done manually, and it's a very tedious process. It's very lengthy. So certain companies start coming up with machines that would do part of the procedure automatically. So the first generation would just do the harvesting that we call, which means obtaining those hair follicles, and then somebody would have to come in and take them out and then put them manually. The equipment that I have in the institute is a robotic, or it's a robot that it's automatically and it's programmed to obtain those hair follicles in the most efficient way, and with the ability to preserve those hair follicles as healthy as possible. So when we put them in their new place, will survive and then have a healthy hair. And this is all done with obviously a computer program that is will do randomly. So because there's also some, I guess, not so good results when people will start doing it in lines, or it looks almost like a doll's hair. So
right.
This machine will do it in a way that it's very natural looking.
Wow, so that brings me to my next question, success rate. What would you say your success rate is? And also downtime. Can you give me a little bit of an idea of the downtime when the patient first comes to you, when they get the procedure?
Well, success rate is 99+%. I mean, it's a very safe procedure. There is really very little complications that patients can have. One of the main, factors that will affect the success for a transplant is to preserve that hair follicle. We call it a graft, intact and healthy, and that's why this machine is so good, because it will read the angle, the depth, every detail that is not visible for us, in order to keep that hair follicle as healthy as possible. So as far as the downtime, patients come in the morning. The process takes about 5 to 6 hours, and then they go home the same day, and maybe that week they can be maybe take a few days off, but there is really no pain involved. If their work allows them to wear a hat or something, they can go back to work in a couple of days. There is really no downtime as such. It just basically depends on each person.
What a gift you're actually giving to people, both aesthetically and emotionally, for people that are really, really debilitated psychologically by losing a head of hair that they once had, man or a woman. So it's really a gift that you're giving. What made you decide to want to help people this way and give them back something that they've lost in the way of hair? When did you, being a doctor that's helped people, remove cancers and save lives, and being a general surgeon, what made you want to help people aesthetically as well with the hair replacement?
Well, I mean, like you said, most of my career until now has been focused in a different way of helping people, but I've also seen that people really care about the way they look and how that can affect people. I see it with my patients that have cancer. When they lose their hair, they become depressed, or if they have a big scar. That's one of the reasons why I started doing single incision gallbladder surgery with a robot as well, because people care about their bodies. They want to look good, they want to feel good, and that has an impact on their life. So I thought that with my experience with robotic surgery, and I found this other application for that, would be another thing that I could do to help more people in a different way.
I think that's really beautiful. It's a very sensitive topic, and I think people feel very helpless out there. They don't know what to do, who to contact, who to turn to when they look in the mirror and their hair is falling out, or it's a very sensitive topic. So that is why it's so great that you are here today talking about it, and it's something that doesn't have to be a secret. There is help for people out there that are going through this. As a matter of fact, any of you viewers that are here listening or watching us this evening, if you'd like to call in, feel free. 888-565-1470. You can ask Dr. Sierra any questions that you'd like. He's here up close and personal to answer any of those. But as far as walk me through, if a new patient who sees you tonight and says, this is the doctor that I want, this is the doctor that I need, and they want to make an appointment and come to you, how does it begin? They come in for what, a consultation, and then what is the next step? What do they do from start to finish?
So they will come to my office. We'll take some pictures. I'll do a exam of their scalp and kind of get also a little bit of their history, family history, to get an idea of what the hair loss pattern is, because within hair loss there's different patterns, and not everybody is a good candidate for a transplant. We need to talk about all these things, and at the end of that consultation, the goal is to have a comprehensive plan for that patient to get the best results for the rest of their lives. A lot of times we can start, let's say a patient comes in that it's young and he knows that his father was bald at age 45 and he's 30 and he's already seeing some changes. Then we can start early and give them an option of kind of prevent to get to that place and maybe even avoid having a hair transplant. If we give them a plan for them to use certain medications or other options. If it's somebody that already needs a transplant, we also can make a plan so the hair that they have doesn't continue to fall off, and we can customize that for their needs.
That's very interesting. Now, is it consecutive treatments that they receive, or consecutive, different types of techniques that you use in different sessions? Is it one large session? How does that work?
So for the transplant, like I said, it's just one session. Some people will repeat and have 2, 3, 4 transplants. That can be done depending on each patient. For the non-surgical treatment, yes, it's something that has to be done constantly. There's topical medication that can be used, and they use that at home. I mean, there's some commercially available Rogaine and all those things. We'll have a specific line that has other things that have proven to be more effective. There's other things that are also commercially available, the Capillus and other things that involve a low-wave laser treatment, PRP, which is plasma-rich, platelet-rich plasma, which basically is your own blood, and we get the platelets, and that has proven to be beneficial in many ways. But for hair restoration, it has proven to decrease the hair loss, and when we do it in conjunction with a transplant, it also improves the results of the transplant itself. So those are things that, yes, they need to be repeated over time, but a lot of it can be done at home, and just patients can come to the institute, and we'll make an assessment and see if it's working, if we need to make any adjustments. Like I said, we try to be very personal and very customized for our patients.
So you make everybody feel comfortable. I can see that in you and your staff. I think that's very, very important, that the patient feels, very comfortable, and it's a very sensitive topic. So now a question that I have is age range. I've seen people that are elderly that have a full head of hair, and then I've seen people in high school that have lost their hair. So what is the age range and the minimum age and the maximum age that would be candidates, and who would be a non-candidate?
So as far as age, I mean, I wouldn't treat anybody that it's under 20 years old. I mean, 21 probably would be the cutoff. Because if it's a younger patient, you have to start looking into other reasons for hair loss. After that, really, the sooner the better. If somebody knows that in their family, it's in their family, it comes down to genetics, a lot of it. There's other factors that cause hair loss, like stress and chemicals and stuff like that, but it comes down to genetics. So if somebody knows that that's something that it's in their family, and they want to come in and they're 25, 30, like I said, it's better to start early so we can prevent that hair loss instead of waiting until they're already at the moment where they've lost 50-60% of their hair.
That's very interesting. I'm sure our viewers are wondering about pain. People think this could be a painful process. Is there pain affiliated with this? And if so, how great is that, or how little is it?
Sure. Yeah, I would lie if I said, no, there's no pain at all. There is a little bit of pain involved, but it's not something that it's excruciating or very, very bad. What we do is we use local anesthetics. We inject the entire scalp before we do the procedure. That part is uncomfortable, but what we do is we give patients a little bit of sedation so they're comfortable as much as possible. But once the local anesthetic kicks in, there is no pain. And after the procedure can be a little bit of discomfort, but it's not a painful procedure.
And what is the homework for the patient when they get home? What do they do? What are the do's and the do nots when they are at home and after they've had the procedure? What do you recommend?
For the first 2 or 3 days, I recommend them to try not to do any strenuous activities. Try not to kind of put your head down. If they can stay as kind of chill as possible. And that's just to decrease the amount of bleeding, because remember, we're talking about 1,000 of little pinholes in the scalp, and the scalp has a really good blood supply, which is good in a way because it decreases the chances of infection and it heals very quickly. But in the first 2-3 days, it's best for patients to stay calm and not do a lot of things. After that, the patients can resume almost their normal daily activities. So again, the downtime is minimal. It just depends on each patient's lifestyle and so on. But there is really not a lot of extra care that is needed.
So side sleepers, back sleepers, anything different with a pillow type of thing, or you just really go to sleep normally, wake up normally, and
Yeah.
That's really good to know.
Pretty much.
I remember back in the 80s or 90s, the Hair Club for Men, you would see these commercials, and they were horseback riding, they were swimming, they were doing all of these outdoor activities after their hair. Your patients, I assume, can do that and more, right? And
Yeah.
legitimately do it and not have to worry
Yes.
about anything happening to the procedure that they've had, right?
Correct, yeah. Usually people can see the final result at 6 months to a year. That's when you can see the final result, because you're talking about there's a period where the hair follicle is kind of in shock, so it's not going to start growing right away. So it takes a little time for those little blood vessels to grow into it and start giving nutrition to the follicle, so the hair starts growing again. So that plus the time that it takes for the hair follicle to start showing up, for the hair to start showing up. So about 6 to 8 months, then people will start seeing the final result, and that's their hair, so they can do whatever they want.
What a true gift. Now, are there any creams, shampoos, special lotions, balms, anything they're supposed to do as a follow-up of self-care when they've left your office?
Yes. So this is a good question, because a hair transplant doesn't stop hair loss. The hair loss continues on those hair follicles that are not the transplanted ones. So we always tell our patients to continue with other treatments, creams, or products that we have in the institute that will once again decrease the hair the hair loss from those hairs that are still there, that are at risk of losing.
It's really incredible. As I'm sitting here listening to you, I'm thinking, my goodness, if this were happening to me, you'd be the first place that I would run, truthfully, because it is so psychologically debilitating to lose your hair if it bothers you. Now, some people, it doesn't bother and it looks great on them, but other people that it bothers, to have a gift like this, to be able to walk into a medical office, to have somebody with your background, your medical schools, your training, to really give them what they want and what they're looking for in a safe manner, in somebody who's as knowledgeable as you. It's a gift that it's really it's infinite. So it's like a miracle, but it's a miracle of medical technology, and I'm really in awe by it. Fortunately, I don't need it, but if I did, I'd probably be your patient without a doubt. One question: if somebody wanted to find you, I'm sure there's many viewers out there that are saying, "Thank goodness for this new Sierra Robotic Hair Institute that I'm listening to Dr. Sierra speak about." Where do they find you? How? I know you're not open yet. You'll be open in about 8 weeks.
Yes.
Do they call? They make an appointment? Who do they speak with? And how do they set it up?
So we do have a website right now. We'll start taking calls probably at the beginning or mid-March. The website is South Florida Hair Transplant and .com. So we will, at this point, we're still not at the stage that we're taking in patients, but anybody can go into the website, look at our information, take note of the phone, and then in the end of or middle of March, we'll start taking in calls for patients.
That's wonderful. We have a call coming in. We're going to go ahead and take that. We have a question for you, Dr. Sierra. Go ahead.
Yes, hello. I have a question regarding costs. What kind of costs are involved in that procedure?
For the hair transplant, there's the average hair transplant is about 2,000 to 3,000 hair follicles, and we're talking about a range between $10,000 to $15,000. So we do different pricing. One is just charging per hair follicle, and that's between $6 and $7. Or we also have a pricing as a small, medium, large, extra large transplant. So it's not a cheap procedure, but it's a procedure that it's for life. So it's just and we have payment plans. It's not something that needs to be paid completely upfront, because we understand that not everybody has that amount of money in their pocket. So
I think that's wonderful that you offer payment plans. Great question that listener asked of cost. But again, what is your self-esteem worth? What is walking out of your house every day feeling self-confident and feeling beautiful or feeling handsome or feeling, great within yourself? What is that worth? It's really invaluable. So, as far as you, Dr. Sierra, you're a very impressive doctor. Robotic surgery is just, the wave of the future. It's something that we only dreamt about, 20 years ago, 30 years ago, and now you've made it possible. So it's really an honor to speak with you and to learn so much tonight about this. You're really giving people something that they couldn't have but for your techniques. So it's a miracle of sorts. It really is. And it's very impressive. So they can find you on your website. I look forward to your grand opening. And as we have, I think, about a minute left, unfortunately, because there's so much that I want to know. But what would you tell your viewers out there of why they should choose you as opposed to another robotic surgeon?
Well, I think my approach, like the approach that I've had all my career, is to make patients and treat my patients like if they were part of my family, and make them feel comfortable and address their concerns and their health as if it was somebody that I care for as my family. And that because I think that we all deserve to be healthy and feel good about ourselves.
There's no doubt about that. It's invaluable, as I said. Well, it was a pleasure to speak to you. You are just incredible, and what you do for people is just such a gift. So thank you for joining us on Tell Us Your Biz. Thank you, Dr. Sierra. It was a pleasure. And we will see you same time, same place next week. Thanks for joining.
Thank you.
This has been Tell Us Your Business, where a special guest comes on every week and tells us what they do. All shows can be seen on amp2.tv, and if you wish to be a guest, call 866-224-5422 and tell us about your business. That's 866-224-5422.